I'm Julia Smith, and I'm with Maryville University. I'm doing a physical examination on my friend John. John's agreed to be my patient for today. I've already washed my hands, and John has emptied his bladder. And in place of a gown, he's wearing a t-shirt and a pair of shorts. We're going to start out with some measurements. We're going to do John's vital signs. Okay, I get 8.0. I'm just kind of check it even just a little so I don't trip. Okay, 96%. Your pulse is at 70 on there. I'm going to get your blood pressure too. This one's got the stethoscope right in it, so can I just have you hold that, please? Just for a second. (138/78). Alright, I'm going to get your pulse here, John. You can just relax. Okay. His respirations are at 16. His pulse is at 76, pretty regular. His breaths were pretty effortless. I was kind of watching. He thought I was still taking his pulse, and I kind of usually do that just so that he has regular breathing and without knowing that he's having that done. So we already did John's distant vision. John does wear corrective glasses. So without the glasses, John is 2400, and then with his corrective glasses, it corrects it to 2020. The first thing I'm going to do is I'm going to inspect John's head and his face, his skin, his symmetry, and external parts of his face, his ears, his skull, and so then I'm just kind of looking. I'm going to grab my pen light. I can kind of use that to look at his eyes. It kind of helps me to see if they're pretty even. Okay. His eyes are pretty even. His nose kind of deviates to his left side a little bit. His ears are pretty even. His mouth is pretty symmetrical. Okay. His skull is pretty good. His face doesn't have a lot of lesions or anything. Skin looks smooth. He has a little bit of a tan. You have an Asian background here, John, so your eyes are a little Asiatic too. Great. And so then I'm going to have him do a couple things for me too. John, can you squeeze your eyes tightly shut? Okay. Now can you wrinkle your forehead? Alright, can you smile for me? And can you clench your teeth? Alright, and then puff your cheeks. Good, good. Alright. So then I'm going to palpate his scalp just to kind of see what that looks like. And his hair, he's got a receding hairline. And then his hair, if I tug on it and stuff, it's not pulling out. Feels fairly normal. I'm going to palpate his facial bones. Good. All right, and then I'm going to palpate his temporal mandibular joint, which is right there. You kind of open your mouth for a second. All right, now clench your teeth. A little bit of clicking in there. All right, and then I'm going to feel the sinus region, his frontal, sphenoid, and maxillary. And those feel pretty normal. I didn't feel any masses or any abnormal anything abnormal within there. Any enlargement. Any pain when I did that?
No.
Okay, good. Good. And then next I'm going to do something called a light sensation. Okay, so I'm going to have you close your eyes, and when you feel me touch you with this, you let me know, okay?
Yes. 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 Yes.
Good, good. All right. All right. So the next part of the exam is going to be looking at John's eyes. First, I'm going to start with looking at the external portion of John's eyes, his eyelids, and notice that on his eyelids, he does not have any drooping. His upper lid just kind of goes partially just over the iris, and that's good. He doesn't have any scaling or any lesions in his eyebrows. He has a nice full set of eyebrows. Let me just look up at me. Good. He's got a good amount of eyelashes, dark eyelashes, and they look pretty healthy. I'm going to inspect the sclera and the conjunctiva, and I have my flashlight in here yet. I'll just kind of. Alright. Maybe you want to look up just so I can kind of see. Good. His sclera is nice and white, and his conjunctiva nice pink and moist. No problems. I don't see any abnormalities within there. I'm going to check his lacrimal apparatus. I'm going to wear a pair of gloves when I do this because I'm very close to his eyes. What I'm going to be looking for on this is if there's any like discharge from the ducts there or anything. Might indicate any infection or other disease process. And that looks good. Any pain when I did that or any discomfort? No. Good. So there, I don't want to trip on you. Alright, so then the next thing that we're going to do is I'm going to kind of go over John's near vision. We know that John, his vision is pretty poor. He's had a history of pretty much all your life, right?
Right.
Okay. What I'm going to do is we're just going to try without it first. If you can reach from like about 10 inches here.
No.
Okay, why don't you grab your glasses and put those back on? And if you could just read like the first 2 lines on there.
Overall healthcare costs are dramatic for older Americans. In addition, between 1992 and 2006, potential healthcare costs are going up to prescription drugs almost double from 8% to 16%, with prescription drugs accounting for a large percentage of out-of-pocket healthcare spending.
Very nice, good. That seemed pretty comfortable for you? Good, good. Alright, so then basically the next one test I'm going to do is a function pupillary response. I'm going to see how his opposite eye, I'm going to flash a light in one eye and see if the other one constricts. Which it does. Good both ways there. Okay, good. And then we're going to do the cover and uncover. Okay, John, if you could turn this way, and I'm going to have you focus on that hanging right there. I want you to put this over one eye, cover it, and then uncover, and then put it on the other one, and then take that off. Good. And then we're going to look at what's called red reflex. I'm going to take a peek into your eyes there. And for me, what's important is I go on the same side of whatever eye I'm looking at. And then I have John look over my shoulder. And I'm going to take my glasses off for this. Okay, John? So what I want you to do is kind of look at that up there. And just keep looking at that as I'm looking in. Okay? Good. Now look at that moose on there. Okay? Good. It's nice and healthy. And I'm going to grab my glasses too. Alright. I'm going to assess his visual field next, and I'm going to look for any extraocular movements. John, what I'm going to have you do is look at my pen, and I'm going to move it in different areas. So you just track this and follow, okay? Good. Very good. And there was no extraocular movements. It looked pretty good. We're going to move on to checking John's ears. We're going to start with inspecting alignment and placement. His ears just sit slightly above his eyes. They're pretty even. And then they're placed normally on his head too. I'm going to palpate the auricle and pinna. And I don't feel any abnormalities in there. We're going to do a Rinn and Weber test. John, what I'm going to do is I'm going to strike this. I'm going to put it on top of your head, okay? And you tell me if you hear the noise that when I stick it up there in either your ears or if it's even, okay?
Okay.
side do you hear more?
This side.
Okay. Is there a side that was more?
No.
I'll just try one more. And is there a side that?
This side.
Okay. And then we're gonna actually put this on. No, can you still hear it? Tell me when it stops, okay? Okay. Can you still hear it?
Yes.
Tell me when it stops.
No.
Okay. So it's just about twice as long. We're gonna do this ear as well. Can you hear that?
Yep.
Can you just tell me when? You stopped it? Okay. Can you still hear it?
Yeah.
And tell me when it stops.
Stop.
Stop? Okay. And just about twice as long too with that. Alright. So John did have some more, he said with the Weber test that he heard more on the left ear. So, you know, we can probably follow up with that. We're going to look at John's nose structure next. And I noticed when I was looking at his nose, you know, that it kind of deviates to his left just a little bit. So we're going to take a look inside too. Actually, I'm going to take a peek. I want to peek at your ear canals first. So with this ear canals, I want to have the largest scope, or the largest tip on my scope, my otoscope. Oops, sorry. Okay. Alright, John. So he's got a lot of serum in there, but I can see past it, and I can see that he's got a nice curly gray eardrum, tympanic membrane, and there's no erythema. This one doesn't have as much serum in, and nice pearly gray. Both are reflective to light. Both, there's no drainage, there's no signs of infection, no redness. Alright. Alright, so then I'm going to also, I just switch my tip here. I'm just going to kind of look up your nose. I'm just going to grab some gloves here. Okay. Can I just have you look up, John? And I'm just going to take a look in there. Got a lot of hair. I can see past there. Good mucous membrane. No swelling, turbinates. And nice mucous membranes. Everything's open, patent. The septum does not appear to be deviated. Another thing we could do is, John, can I have you take one finger on one side of your nostril and blow out the other? And do that with the other side too. Alright. And that side kind of plugs a little bit, doesn't it? Okay.
Yes.
So, He does get passing of air, but there is just a little bit of roughness when he is. Alright, so when I'm looking at his mouth and his pharynx, I'm going to look at his lips. John, his head was up. No, I mean, hold your chin up. His lips look nice and pink, moist. He doesn't look dehydrated. Take my pen light. I'm going to grab your buccal mucosa. It's going to open. That looks good. Tonsils. I'm just going to... Okay, so basically his hard palate looks good. I'm going to have you lift up. You just lift up your tongue. It looks good. Under his tongue. Soft palate looks good. Floor of his mouth looks good. Back of his throat, the uvula looks nice and centered. He does not have halitosis or any kind of mouth odor. Tonsils, I would say they're a grade 1. Teeth, pretty white, you know, for age-wise and stuff. Has a, let me just kick in there further. He's got a cap in the back and looks like a couple of fillings there. You had a removal on that back left side too. The color of his tongue looks nice and pink. The surface of his teeth look real good too. You get fluoride treatments? Good. And then his tongue looks symmetric. What I can do too is, John, I'm gonna push on your tongue and you just push against it. Good. All right, and then one other thing too. I'm gonna have you just say ah one more time. Okay. And I'm gonna go there. Oops, sorry. And he has a good gag reflex. All right. And then basically, then we're gonna move on. How you doing?
Fine.
Good. All right. So I'm gonna look at your neck next, and we're gonna inspect your neck for symmetry, smoothness. Can I just take a peek here? You want to sit up? I'm looking at your neck. Here, turn this way. Yeah, you don't need to turn yet. So if you can sit straight. There you go. And I don't see his jugular vein. I don't see his thyroid really without palpating. I can see his Adam's apple though. Can you do some turning with your neck? Some flexion, extension. Okay. I'm going to turn down and then go all the way back. And then we're going to have you go to the sides. And then turn as if you're looking over your shoulder. So his range of motion is really good. And then I'm going to do a little bit with resistance now. I'm going to push against my hand, turning your head, and then the other way. And then I want you to shrug your shoulders, and I'm going to push down but keep trying to shrug them. Good strength. All right. And then basically I'm going to palpate the carotids with my hands, and I do one at a time because I don't want to occlude blood too much and cause them to pass out. Check and feel. Good, and I'm looking at the tracheal position while I'm doing that then. There's no deviations, aligned great. His lymph nodes then. Alright, John, you can turn forward here just a little bit. Can you tuck your feet in just so I can get in closer? I'm looking at pre-auricle, post-auricle, auricular, and then tonsillar, submandibular, submental, and then superficial cervical chain, posterior cervical, deep cervical, and then supraclavicular. Good. I didn't feel any enlargement or anything, any abnormal palpations. Did you have any pain or tenderness when I...
No.
Okay. So next I want to do is I want to auscultate his carotid arteries. And I'm going to have you hold your breath. gonna palpate or auscultate your thyroid right away. No bruise. So that test was normal. Next I'm gonna inspect John's hands. So the skin, you can just a little bit dry. We're just getting done with winter too. No calcifications in your knuckles. Your wrists look good. Just gonna extend your arm out, feel your muscles. His arms, good muscle mass. Good. And then your radial. I'm going to do the same with the other side here. So you have good muscle mass. And then we're going to check your radial pulse. And then while I'm doing this, I'm just going to check cap refill. Definitely less than 3 seconds. And let's just check your other one quick. Your fingernails look nice and well trimmed and clean. You don't have any clubbing or anything like that. So, and then I'm going to look and palpate your shoulders just to see how that is. And that feels pretty good too. Any pain when I'm doing any of that?
No.
Can you lift your shoulders up without pain too? Good. Good. All right, and then so I'm gonna, John, can I have you kind of turn around this way, and then can we just kind of, you want to take your shirt off? All right, so looking at John's back, I'm kind of looking for any abnormalities. Looks like you may have just a little bit of acne. All right. And then his thoracic configuration. We're going to look at how big his chest is. Can you just go ahead and just kind of. Okay, so lift your arm up. I'm just kind of looking at your side view here. So his side is about this is about twice as big. So that's good. You're not a smoker, right?
No.
All right, and then I'm going to palpate and percuss the costovertebral angle. So that's at the bottom here. And then what I'm going to do is I'm just going to. Any pain with that?
No. No.
I'll just do it again so they can see. Okay. All right. You can turn back around here. All right. So actually next I'm gonna listen to respirations. What I'll have you do is just kind of turn again. I'm sorry, just so that they can see on the camera there. I'm gonna come over this way though. All right. Nice deep breath in and out. Actually, I'm just going to back up for a second. So I had inspected his respirations, and I'm going to palpate his expansion. Go ahead. All right, and if you want to swing around, I'm going to palpate the front. Okay. And you can see my thumbs moving in together and out. And then I want you to turn back the other way then. We're going to check for tactile primitus. I'm going to have you say 99, going down.
99. 99. 99. 99.
Okay, and then just turn toward the here then. So I'm going to continue on with the front here.
99. 99. 99.
Good. And that's nice and even. All right. And then basically then I'm going to percuss the. I'm going to have you turn around again. I'm going to percuss his posterior chest. And all the way down. Side to side. There's no dullness. That sounds good. All right. And then basically I'm going to check, compare side to side with auscultation. I had started to do that. Let's just go back. We're going to listen to your lungs again. Okay. All right. So then basically I'm going to listen to basically his anterior chest and his lateral chest as well. So kind of take a nice deep breath in. And just systematically those ribs. Let's put the bottom right there. Good. Okay. And that was normal. And then what I'm going to do is basically listen for his heart sounds. I'm going to start with the aortic, move to the pulmonic, Erb's point, tricuspid, and finally the mitral. Normal S1, S2 sounds, normal rhythm, normal rates. So that sounds good. And then so next what we're going to move on to is John's abdomen. John, looking at John's abdomen, and I'm just wondering, maybe we should have you lay on the bed. Okay, so basically, for this here, I'll just kind of go to where I listen to your belly and stuff, and then I'll have you get back on here. I'm going to actually sit in the chair because this bed doesn't crank up. Okay, so inspecting John's abdomen here, I'm looking at it's nice and round. It doesn't appear to be significantly obese, but just maybe slightly. And we had gotten John's weight ahead of time. What was that again? That was
217 pounds.
217 pounds. And then basically I'm going to look for any pulsations or movements. And I'm going to grab a couple things here. Okay, so I can kind of beam the light across here. And I can see if there's any visible masses or anything that are abnormal. And I don't see any. And then I'm going to listen to all four quadrants. And I would listen for 2 minutes, but if things are irregular, listen for a full 5. So let's. His bowel sounds were active ×4. They weren't hyperactive, they weren't hypoactive, they were just even keel. So next I'm going to auscultate his arteries then, his aorta. And there's renal. Iliac. And then femoral. Okay. Alright, so then I'm going to basically percuss for tone. And then one of the things I can do is I can kind of measure, let me see if I can do this. That's where it changes. I can mark that. I think I got a pen here. What do I got? Let me start at the bottom here. Interesting to see what that is. And 8 centimeters. Alright. And then I can kind of do some Alright, and that sounds pretty normal. Alright, and then I was checking for the liver borders too. And actually when I measured his livers, you know, like with checking using the basically percussion there, I was actually able to measure 8 inches, and it just goes just right under the ribs right there. His I was checking for splenic dullness. I'm going to do some light palpation. Is any pain, John?
No.
And then like costal liver. Okay. And then left costal for the margin of the spleen. And the right and left kidneys. There we go. And then midline for any aortic pulsations. Not feeling those. So normal. And then I'm going to check his abdominal muscles. See if he responds. Okay, that's good. Alright, so I'm going to have you sit up, John. I'll probably have you go back to the chair and you can slide that back too. Did you want to put your shirt back on? Alright, I'm going to sit next to you here on the bed then. I'm going to kind of look at your legs. Okay, so he's got good hair distribution. Just kind of checking his circulation. His temperature of his legs, pretty warm. Let me feel your other one too. Good hair distribution on both legs. And then his muscle mass is pretty good in his legs. Good. Good. Any pain when I'm...
No.
I don't feel any masses or anything like that. His skin is nice and pink. Everything looks good. The temperature doesn't seem to have any edema. His ankles are... Yeah, that looks good, no edema. And then I'm going to check your pulses there, John. So I'm going to check your dorsalis pedis. Good. And then your posterior tibial. Good. And one more popliteal. Good. And then we'll do this on the other side too. Dorsalis pedis. Posterior tibial. And popliteal. Good. Good pulses. So next then what we're going to talk about a little bit is cranial nerves, and actually through most of my examination we've covered pretty much all of them. But we are going to start with cranial nerve 1 is the olfactory. And actually in some research, sometimes people out there, they have new stuff out there, literature out there, that if there's some problems, with this too, there might be some problems with Parkinson's. John, what I want you to do is, if you could just plug one of your ears, and I'm going to ask you to smell what I have, and you tell me what it is.
It's coffee.
Okay. Now do your other one. Good. Nice job. All right. So put those down. And so he was able to distinguish the two different smells. So his olfactory was within normal, or the cranial nerve 1. His cranial nerve 2 is just in vision. He has some problems with his vision, 2400, and his near vision as well. He has to wear corrective glasses. His eye on the internal structures with his optic nerve in the back of his eye looked really good. His confrontation, he didn't have any extinction of vision. He did not have any he doesn't have any drooping. His pupils are equal and reactive to light and accommodating. He has no extraocular movements when I was checking with him with his exam. Cranial nerve, his optic nerve, cranial nerve 2 is intact. Cranial nerve 3, 4, and 6 are actually cranial nerve 5, when I was checking his teeth when he was clenching, and the temple, palpating his jaw when he clenched his teeth, that was good. I tested his facial nerves with his smiling, frowning, and that was good too. I tested bone and air conduction, so his acoustic nerve was good. Lateralization of sound, he has a little bit more on his left than on his right. So there's a little bit of, that was, his conduction was a little bit off there, or with his lateralization of sound. He does have a good gag reflex and the ah reflex. So the glossopharyngeal is good. His vagus nerve is pretty normal. Doesn't have a nasal or hoarse quality of his voice. He's got good strength in his trapezius muscles, and when he was shrugging his shoulders and the resistance, he also is able to turn head side to side with the resistance good. So his spinal accessory, the cranial nerve 11 is good, and cranial nerve 12. He basically didn't have any tremors or atrophy in his mouth.